Hello, everyone. My name is Clinton Marquardt, and I'm a sleep and fatigue specialist working out of Ottawa, Canada. What I'd like to talk to you today about is this idea or this concept of requiring 8 hours of sleep. So I've titled the talk Myths and Realities of 8 Hours of Sleep. And what I'd like you to do is think back to last night and try and calculate how much sleep you obtained last night. Now, after you've done that, think back to the night before, and the night before. And now maybe look back across about 7 or 8 days and try and average out how much sleep you obtained each night. Now think about whether or not that was enough sleep. Do you remember ever feeling fatigued or sleepy during the day? And think about how that day progressed. Most of us trudge through it. We might feel a little bit fatigued. But if you don't sleep enough, there are some pretty negative things that can occur from that lack of sleep. So what we typically see in the short term anyway is that if you repeatedly get less sleep than you require, you suffer from more colds, coughs, and flu. So in other words, your immune system doesn't work quite as well. Now this might be really important in today's time because we're going through the COVID pandemic. And what we see is that if you drop your sleep time to about 6 hours or less for a few nights in a row, and you're exposed to the cold virus, there's some really good research shows that you're 4 times more likely to contract the cold afterwards if you've been exposed to that virus compared to somebody who's getting the right amount of sleep. Now, we don't know what this means in terms of the COVID virus, but if your immune system isn't working as well, there's a pretty good chance it means you're more susceptible to things like COVID. So pretty dangerous outcomes. Now, that's not the only outcome that you see. You typically see things like longer recovery time. So if you get injured, it takes longer to recover. Or if you're working out, it takes longer to recover. Let your bodies and muscles rejuvenate. We see things like short-term weight gain. We've seen learning difficulties, poor interpersonal skills or interpersonal facial recognition, I should say. So if I look at your face and I'm fatigued, I haven't gotten enough sleep, I might not be able to understand what you're trying to convey with that facial expression. Now, there is one really good thing that comes from not getting the right amount of sleep, and that is a little bit of extra time. What I want you to do is keep that benefit in mind as we talk about some of the other things that can happen when you don't sleep enough. So one of the things that we see is people who don't sleep enough actually are more prone to automobile accidents. So some good research out there that shows that if you essentially double your shift length, so you work a long day, like 16 hours or so, you are upwards of the same number, 16 times greater risk of having a motor vehicle accident on your commute home after that really long commute. One of the reasons for that is that if you don't sleep long enough, you will experience a longer reaction time. So it takes you longer to react, and your ability to stay focused on a task, which we call vigilance, is impaired. So there's some attentional issues that occur too. So that if you push it even further now, so think about a long duty day of 16 hours or so, you're awake before that and you're awake after that. If you're awake as long as 17 hours, taking in the time in before and after work, some aspects of your behavior, some aspects of your performance will be down around what you'd see in somebody with a blood alcohol concentration of 0.05%. So that's illegal in most provinces, states, and perhaps the world. Now bump it up even longer. Stay awake for 21 hours, and what we see is some aspects of your performance drop to what we see in people with a blood alcohol concentration of 0.08. So that again is an illegal level. You wouldn't want to be driving your car at that level of alcohol intoxication. And if you are performing the same way when you're fatigued, you probably don't want to be operating your vehicle in that fatigued state or doing anything really safety conscious. So it is important to realize that there are these short-term negative outcomes that occur when you don't sleep enough. Now notice I mentioned the term fatigue in there. Now, the type of fatigue we're talking about today is what I call sleep-related fatigue. It's another way of saying sleepiness. Some people say that fatigue is really low levels of sleepiness. Some people just call fatigue and sleepiness the same thing. In my world, the way I work is I call fatigue, sleep-related fatigue, that is sleepiness. So the same term. It's a little different from what we refer to as physical fatigue or mental fatigue. Let me give you a quick example of each. So mental fatigue. If I were to drone on here for 4, 5, 6, 7 hours in a row, it would be harder for you to pay attention, harder for you to stay focused on what I'm telling you, and perhaps harder for you to learn what I'm trying to give you, learn the information. Okay? You would be mentally fatigued. Give you another one. Hopefully you're in your room, perhaps not with a lot of people looking, because this is a little bit corny. What I want you to do is raise your hand and now open and close your fist. Open and close your palm. Now do that with your arm raised so that you feel a little bit of strain under the arm. Now do that for 3, 4, 5 hours. What's the first thing that's going to happen? Most likely your arm will become fatigued. And if you ask somebody, how do you feel? They would say, I'm fatigued. That's what we refer to as physical fatigue. Just because you've done this for 4 or 5 hours doesn't mean you're going to fall asleep more quickly. So it's a different type of fatigue. Different types of fatigue, the fatigue coming from different sources, requires different solutions. You know, the solution for this, stop doing that. Give your arm a rest. Solution for mental fatigue, after listening to me or some other speaker for a long period of time, you take a break and then you can go back to it. Sleep may or may not help. The only solution for sleep-related fatigue or sleepiness is sleep. You have to give the brain and body what it needs. So it's important to understand the type of fatigue you're experiencing so that you can put the correct solution in place. Now, remember I mentioned there's these short-term outcomes. Another reality is that if you don't get the sleep you need for a longer period of time, so we're talking 5, 10, 15, perhaps a 20-year career, especially shift workers, this is a big concern, you see some even more negative consequences. Things like diabetes, heart attacks, increase of cardiovascular accidents like strokes, increase in mental health issues as well. Then remember the little bit of extra time you got by shortening your sleep? Well, you pay it back at the other side of things. So typically people who don't sleep long enough for a long period of time, they die sooner. So you pay for that time at the end. Now, the question might be, or you might be thinking, yeah, but you know, I'm young now. 1 minute of time now is worth a lot more to me now than it is when I'm 80 years old. Now, the problem here is that we don't know what that ratio is. So if you shortchange yourself of, say, 5 minutes of sleep now, does it result in 5 minutes less life later? Or does it result in 10 minutes, 20 minutes, an hour? We don't know what that relationship is. So it's you know, if you're playing with that ratio, playing with that risk a little bit, you might want to think about what you're taking on for getting that extra time now. So how much sleep is enough? Do we really need 8 hours of sleep? Well, here's a bit of a myth and a reality. We don't all need 8 hours of sleep. The normal range, so that is the normal range across the whole population, is somewhere between 6 to 9 hours. Now, it's a little bit heavily weighted at the higher range, which means the average comes out at about 7 or 8 hours. So that's where that reality comes in. But the myth is we don't all need exactly 8 hours of sleep. And it's not 8 hours of sleep for every day. It's 8 hours of sleep for every 24 hours of life, really. Okay? So 8 hours of sleep, 16 hours of wakefulness. If we go back to the other number, where I said 17 hours of wakefulness decreases your performance to perhaps dangerous levels, now it makes sense. You've breached 16 hours, you've gone to 17 hours of wakefulness, you've used up your 8 hours of sleep and your 16 hours of wakefulness, so now you should be trying to get a bit more sleep. So just how much sleep do you need? Well, this is what I refer to as the sleep sweet spot. And the sleep sweet spot is the right amount of sleep that makes you feel good about 1 to 2 hours after waking up. And the reason I say 1 to 2 hours after waking up is because we all feel a little bit groggy, a little bit tired, and we don't perform that well immediately after awakening. We'll come back to that in a few moments. Now, here's another myth to think about. You often hear that all sleep is the same. So I sleep during the day. Daytime sleep is the same as nighttime sleep. And nap sleep is the same as nighttime sleep. One night of sleep is the same as another night of sleep. The myth here is that all sleep is not the same. The sweet spot in terms here is when your sleep quality is high. So you have to look at quantity as well as quality of sleep. So what does good quality sleep look like? Good quality sleep means you transition through 4 stages of sleep. Now, they're not very creatively named. They're called stage 1, 2, and 3, and then a stage of sleep called REM sleep. REM sleep stands for rapid eye movement sleep. It's the stage of sleep where we do most of our dreaming, and it's a little bit lighter sleep. Stage 1 sleep is light sleep. Typically, people don't even feel like they are sleeping in stage 1. Stage 2 is sort of a transitional stage, and stage 3 is deep sleep. We also refer to it as synchronized sleep. So what you need to see for good quality sleep to hit that sweet spot is not only getting the right amount of sleep, but getting the right amount of each stage of sleep. To get the right amount of each stage of sleep, it means you shouldn't be experiencing lots of awakenings in the middle of the night, or what we call brainwave arousals, where your brain will jump from a deeper stage of sleep into a lighter stage of sleep. That tends to interrupt a nice sleep pattern across a whole night. And notice I'm referring to good quality quantity sleep being nighttime sleep. We're programmed to sleep at night. So daytime sleep is generally of poor quality and oftentimes shorter as well. The other thing to keep in mind when you're talking about high quality sleep and trying to hit this sleep sweet spot is that it can only occur in a good quality sleep environment. And I'll give you some tips on how to build a good environment in a few moments. So here's a picture of one person's sort of textbook version of the sleep sweet spot. What you see here in this slide is hopefully at least a U-shaped pattern where you start off in the lighter stage of sleep and then you go into the deeper or transitional stage, stage 2, then 3, then back up to 2, sometimes to 1, and then to REM sleep. And that U-shape down into deep sleep, back up into light sleep gets repeated 5-6 times per night, depending, of course, how long you sleep for. So that's what a really good quantity sleep looks like. That's what a sleep sweet spot looks like. If you have an awakening or an arousal, it would disrupt this pattern. And disrupted patterns mean you're not getting the right amount of each sleep stage, which then makes you feel poor during the day and doesn't refresh you as well. So that's not your sleep sweet spot. Sleep sweet spot. To get a good quality and quantity of sleep, you should be sleeping in the right environment. And the right environment matches the state that your brain and body go into when it's asleep. We sleep with our eyes closed, so it should be dark. Typically, we're not talking very much or listening to noise while we're asleep, so the room should be quiet. We also see that the blood in your brain and in your body cools down a little bit. So your room should also be cool to match what your brain and body wants to do. And when we are sleeping, we're typically not swallowing, not producing as much saliva, and it means our upper airways can dry out a little bit. So if you keep your upper airway sort of lubricated with a bit more humidity in the room, it can be easier to breathe. Now, what happens if your room doesn't look like that? Your room is not quiet, dark, cool, and slightly humid. Humidity. One thing you can do is buy one of those cool water steamers, or some of the hardware stores have really jiffy little portable devices where you can sit a normal water bottle like this one in it, and it diffuses the moisture into the air. So that's one way of getting it a bit more humid. Cool, well, you can use a programmable thermostat, and keep in mind your body temperature starts coming up when you wake up. So a programmable thermostat that brings the temperature up when you want to wake up, cools down when you want to sleep, can be helpful. If you don't have that, you can open a window or perhaps blow a fan on you, as long as you find it comfortable. Dark, I've got a really neat little eye mask right here. It says remove before flight from the aviators, a gift from some aviators. So if it's not dark in your room and you can't perhaps get some blackout curtains, an eye mask is a perfect technique. If your room is not quiet enough, you can use earplugs. Now, I don't recommend the orange ones that you stick into your ear canal. They can expand and become quite uncomfortable. So what I recommend and I'm not sure if you can see it in the camera here, but it's a little wax silicone type putty earplug. And you spread the putty out in the extra-auricular space, the space outside the ear canal, and it muffles sound just enough to keep it quiet. That's a great technique for making it quieter. Another really nice one, and again, as long as you enjoy it, you can use a noise or sound generator to play white noise or a nice rainforest or whatever the music is on there. That can be quite helpful at drowning out extraneous noise. Okay, so why don't we hit this sleep sweet spot every single night? Well, one of the reasons is we're not sleeping in the right sleep environment. I gave you some tips on how to fix that. There's a number of different sleep snatchers out there, things that snatch away your sleep sweet spot or make it hard to hit. Mentioned environment. Another one is sleep problems and sleep disorders. There's currently about 90 or just under 90 medically recognized sleep disorders out there. So you can go into a sleep disorders center and come out with your choice of one of 90 different sleep disorders. Now, a sleep disorder is a little different from a sleep problem. Sleep problems generally show similar patterns to sleep disorders, but they don't meet the clinical criteria. So for example, people with insomnia, so they can't fall asleep, they wake up in the middle of the night, or they wake up before their alarm and they can't return to sleep, will complain about insomnia. But if it's not happening frequently enough and disrupting your life, then it may not meet the diagnostic criteria. Okay? But if it's still disrupting your life, doesn't happen frequently enough, it's considered a sleep problem. So what I recommend is, if you're having sleep troubles, that is, you can't get the quality or the quantity of sleep you need, that is, you can't hit your sleep spot, and this is happening 2 or 3 times a week, and if it's disrupting your life at all, it's time to talk to your medical doctor. Get a referral to a sleep clinic. If you wish, you can send me an email and I will give you a sleep study requisition form that you can take to your doctor, have your doctor fill out, and get a referral into a clinic. Okay, so we've got sleep environment, we've got sleep problems, sleep disorders. Another sleep snatcher is where we prioritize sleep in our life sleep priorities. This has been a problem, a struggle for humans for centuries. If you look back at some of the interesting quotes from even the mid-1700s, you see that people were prioritizing life activities over sleep. So Benjamin Franklin, one of his quotes, he said, "Are we sleeping enough in the grave?" The 2 quotes at the bottom, "I'll sleep when I'm dead," and "sleep is a waste of time," they came from me talking with people in today's day and age. So still, people don't think that sleep is worth the time you put into it. So this is the thinking that we're kind of fighting, and it gets echoed across our cultures, perhaps throughout the world. So this is a reality. This is a culture. This is a change that we should be seeing. This is a sign from the Rockies. I was driving through the Canadian Rocky Mountains, a place where you should have your wits about you. You should not be fatigued. You should be driving well. You should be, as they say, fit and well rested for duty. And I saw this sign. I couldn't help taking a picture of it because I think it still echoes how a lot of people feel today. I'd much rather see a sign like "sleep is for champions" rather than "sleep is for sissies." Here's another one. I was driving through a pretty complex area on the highways of Montreal a little while back, and I saw this tractor trailer sort of weaving in and out of traffic, trying to navigate his or her way through the other traffic. And on the side of the trailer, it says, "miles to go before I sleep." So this whole company's tagline is around, let's get work done before we sleep. And I would argue, no, let's get our sleep done before we work to stay safe. So there's no silver bullet here. What you need to do is think about what you're trading now for sleep. Are you trading a little bit of time, accepting perhaps a little bit too much risk with illness, car accidents, and then think about what happens 10 or 20 years down the road if you do this repeatedly. If you want to reprioritize sleep in your life, it's going to mean some difficult decisions. For example, if you're a shift worker, there's a chance you might not be able to make every single family gathering, every single sports event for your children. But you can get benefits that a non-shift worker might not have, like extra time with your family at other periods. Okay? So it does mean some difficult decisions and a re-examining of where you position sleep in your life. The fourth sleep snatcher I want to discuss is what I call the stress, anxiety, sleep vicious circle. Vicious circle, vicious cycle, however you want to call it. So this circle, this sort of never-ending cycle goes something like this. Our stress level goes up, which leads to higher anxiety. Higher anxiety changes your brainwave pattern, which makes it more difficult to hit your sleep sweet spot. It disrupts the quality and quantity of your sleep. When you are more fatigued, when you haven't obtained the right quality and quantity of sleep, that is, you haven't hit your sleep sweet spot, your stress and anxiety will increase, which then, of course, makes it harder to hit your sleep sweet spot. So you have to intervene there somewhere. You have to stop the frequent awakenings, frequent arousals that come from this cycle. Sometimes people take a lot longer to fall asleep. And of course, we see some changes in mental and physical health when you're not sleeping well too. So you have to intervene somewhere. So here's a couple of tips on how to intervene. First thing to do is think about what's going on with the stress in your waking life and before sleep. So take steps to manage that a little differently. If you look up stress reduction techniques on the internet, you'll find tons of them. One of the ones that I talk about is what I call exhaustion journaling. And what you do is a few hours before sleep, you take a notepad. Don't type it out, because there's something about writing it in hard copy format that helps. And write down all your stressors, write down all your to-do list, and then you put that notebook aside. And so now you've taken all your stress, you've gotten it out, and you put it aside. And you do it until you can do it no longer. So you exhaust that stress, exhaustion journaling. So you try that, right? And after you've tried that, then you start working on the stress and anxiety that can make it difficult to fall asleep just before bed. So first thing you want to do is wait until you feel drowsy before going to bed. Okay? So what do you look for? You look for your slower eye blinks, relaxation of muscle tone, so your head might be bobbing up and down, perhaps some trouble concentrating. Then go to bed and try to sleep. If you don't fall asleep within about 10 minutes, get up, get out of bed, and go and do something relaxing. Okay? Wait until you feel drowsy again before you return to bed to try to sleep again. Okay? Something relaxing. When you're doing this relaxing activity, make sure the light is subdued. Remember the ideal sleep environment, so subdued, cooler, quiet. I suggest pulling out an old textbook or perhaps an old magazine that you flip through a number of times, and you do this until you feel drowsy. Okay, return to bed. If you don't fall asleep within 10 minutes, you repeat this until you fall asleep. And what this does is it pairs the bed and the bedroom with falling asleep quickly. Okay? So the more often you do it, the more likely the bed and the bedroom will send a signal to your brain that it is time to fall asleep. It's a behavioral association pattern that works really, really well. Okay? So that's one good set of techniques to try to break this vicious cycle. So what about when you've tried your best to manage sleep, you've dealt with as many sleep snatchers as possible, but you still get a bad night of sleep? And I have occasionally underlined in this slide, because I'm hoping if you are not sleeping frequently, then you go and talk to a sleep professional to get a little bit of help, perhaps get a sleep study to see what's going on. So when you occasionally don't hit your sleep sweet spot, what can you do? There's a couple of myths and realities that we should talk about here. The first one is addressing the notion of we can't make up for lost sleep. So you might hear people talking about you can never pay back a sleep debt. The reality here is that if you have a large enough sleep debt, yes, it's biologically impossible to sleep the same amount of sleep that you lost. I'll give you a really good example of this. There's a world record set by Randy Gartner, and it was set in 1965. Randy Gartner, a 17-year-old, stayed awake for 264 hours and 12 minutes, about 11 days. Okay? If you work out his sleep debt using a fancy little formula, you'll find that he was suffering from a sleep debt of about 132 hours. So to pay off that sleep debt, he'd have to sleep for 132 hours. That's biologically impossible. You can't sleep for that long. Okay? In fact, Randy, his first night of sleep, slept for 14 hours and 40 minutes. Second night, he slept for 10 hours and 30 minutes. And he was good to go on the third night, probably slept around 8 hours. So he didn't pay off his sleep debt, but he was fine. So the reality here is, yeah, you can't pay off a sleep debt. The myth is that you have to pay off a sleep debt. And you don't. You just have to get about 2 nights of good quantity sleep, and that sleep debt will be essentially paid off. The other reality here is that the consequences, or not all, some consequences of that sleep loss can't be paid back. So for example, one of the short-term outcomes from not getting the right sleep that you need, so not hitting your sleep sweet spot, not getting the quality or quantity of sleep that you need, is that it's hard to consolidate memories. So you have trouble keeping things in your short-term or working memory long enough so that they can then be encoded into long-term memory. If you've lost that memory, it's gone for good. You don't know you've lost it. So yes, that's a reality. It can never be recovered. Okay? So the idea of sleeping in on weekends, that's a good way to pay back your sleep debt, to make up for lost sleep. You can make up for poor quality sleep by a little extra sleep as well. So maybe you got 8 hours, but you tossed and turned all night long. Great way to make up for that is to take a nap. That'll bring up both your total sleep time, but help with fighting off the effects of poor sleep quality. Okay? So napping, let me give you a couple of tips about napping. So there's 4 rules that are important to keep in mind when you are talking about napping. Okay? First thing to keep in mind is some sleep is better than no sleep. Go back to our little discussion of sleep stages. I mentioned that stage 1 sleep doesn't feel like sleep. But if you look at what's going on in your brain, so your brainwave pattern, your eye movements, your muscle tone, it's a different physiological state. And if you spend some time in stage 1, it can help alleviate some of the fatigue. It can help replenish the quality and quantity of sleep that you did not obtain. Okay? So if you hear people saying, I never nap because I can't sleep, the next question should be, well, do you at least feel a little bit relaxed? And if you do, there's a good chance you're getting some stage 1 sleep. So don't skip that nap just because you don't feel that you get into a deep stage of sleep. If you feel relaxed, good chance you're getting some stage 1, and it's probably helping you. Next rule to keep in mind is more sleep is always better than less sleep. So a longer nap is going to help more so than a shorter nap. But you do have to factor in your next sleep period, the goals for your next sleep period. Right? You can't take a 2-hour nap at 7 o'clock at night and then expect to be in bed at 10 o'clock and sleep again. So factor in your next sleep period. And of course, getting a good quality and quantity of sleep in your nap requires a sleep conducive environment. And again, if you don't have that perfect bedroom, try and fabricate your optimal sleep environment to help you. Okay? The other thing to keep in mind, remember how I said that your sleep sweet spot is when you have slept enough and obtained the right quality of sleep such that you feel good 1 to 2 hours after awakening. And I mentioned that, most people feel a little bit groggy, fatigued, and don't perform well immediately after awakening. This is because of what we call sleep inertia. Sleep inertia is your brain and body returning to the awake state after having been asleep for a period of time. And if you are doing something safety critical, you're trying to remain safety conscious. So for example, maybe you were trying to do a long drive, you felt some fatigue, so you took a nap. You would experience sleep inertia after that nap. So it's not a good idea to just wake up, turn the ignition on, and start driving. You want to get rid of that sleep inertia. And a great thing to do is to engage your mind and body for about 20 minutes after the nap to sort of shake off that sleep inertia. And you don't have to do anything terribly complex here. To engage your mind, you can do a crossword puzzle, tell some jokes if you're sitting with somebody, or have a stimulating conversation with the person that you're beside. Okay? Body-wise, engaging the body doesn't require that you do a hardcore workout. Something as simple as maybe rotating your arms for that period of time can help to shake it off. So if you do this engagement of mind, body for about 20 minutes after all sleep, you should be safe to operate at that point. But never sleep and then get right back into some sort of activity that requires a high level of safety and high performance. So I didn't give you an exact nap duration. Okay? Remember I said more sleep is better than less sleep, and some sleep is better than no sleep. So I didn't say, how long should you sleep? Well, if you need an exact time, and you'll also hear out there, the perfect nap is 20 minutes long. Well, let me give you a couple of timings or durations to keep in mind, and we'll go back to the idea of a sleep cycle. So the transition from light sleep to deep sleep to light sleep again. This sleep cycle takes about 90 minutes. So that U-shape, deep sleep back into the light sleep, about 90 minutes or so. About 40 minutes in is when you're perhaps more likely to be in deep sleep. You don't want to wake up from deep sleep because sleep inertia is worse. This is when you take a nap and you wake up and you actually feel worse after that nap, probably because you woke up from deep sleep. Right? So to try and avoid waking up from deep sleep, the research shows that if you cut your nap off at about 20 minutes, you'll get some stage 1, stage 2, and wake up feeling okay. Or if you sleep longer than 80 minutes, you'll get some stage 1, 2, 3, 2, 1, and wake up again. So you're waking up from lighter sleep again. So that's why the range 20 to 80 minutes should be avoided. Now, knowing exactly when somebody's going to go into deep sleep is really difficult. So you may find that this 20 to 80 minute range actually works for you. And yes, because there's so much variability between people that it's really hard to predict when you're going to get into deep sleep. So I always revert back to the rule of always do something to dissipate sleep inertia. So control sleep inertia at the end, and then don't worry about the nap length. Nap the length of time that makes sense for you. Right? Now, one of the best ways that I mentioned to help alleviate fatigue, to help deal with not hitting your sleep sweet spot every single night, is to give the brain and body what it wants, which is sleep. So solving sleep-related fatigue, best solution is sleep. Thus the discussion about naps. Another way to do it is to change your brain chemistry by consuming something. And the best thing to try is caffeine. This goes back to some of the studies that NASA did quite some time ago. They had a team of researchers called the NASA Z team, Z for sleep. And their research came out in the early 1990s that showed that caffeine was an amazing product, an amazing substance, an amazing molecule to help fight fatigue. Now, it doesn't obliterate fatigue. What it does chemically is it blocks the fatigue signal in your brain. So if you take caffeine away, let your brain and body process it, you're going to be fatigued again. So you haven't got rid of it totally, you've essentially masked it. So if caffeine is a great solution, sleep is a great solution, why not combine them in what we call the nappuccino? So here's how the nappuccino works. What you do is you consume caffeine. One dose is fine, and a dose is about 100 to 120 milligrams. And then you try and sleep right away. So before the caffeine hits you, you lie down, you take a nap. Going back to our previous rules, 20, 30 minutes, wake up. Or if you can, nap as long as you possibly can and allow your brain and body to wake up naturally. Control the sleep inertia again by engaging your mind and body for 20 minutes after the nappuccino, and you'll be good to go. And the research on this approach is pretty conclusive. It works well. Remember, these are strategies you can use when you occasionally don't get the sleep you need. That is, you're not hitting the sleep sweet spot. If you're not getting hitting your sleep sweet spot on a regular basis, again, time to chat with a health professional. So if you want to try the nappuccino, you also have to be sensitive to caffeine. Now, not biologically sensitive, but your brain has to be sensitive to it, which means that you should only be consuming about 1 pleasure dose a day. So the pleasure dose is you had some nighttime sleep, you get up and you have a cup of coffee with your breakfast. That's a pleasure dose. I mentioned that a dose is about 100 to 120 milligrams of caffeine. So how much is 100, 120? Well, that's about 1 medium cup of coffee. And there's a huge variability here depending on where you get your coffee and how you brew it. To put it into context, the original Red Bull, the can that was probably about this high, only has 80 milligrams of caffeine in it. So it's a little less than 1 dose and would work within the nappuccino context. Right? Now, you might be saying, well, I'm consuming 3-4 cups of coffee a day already. Will this nappuccino approach help me? Chances are it won't. You've got a buildup of caffeine in your brain, and taking a little bit more probably isn't going to help much. The only way to be able to use this strategy is to bring yourself back down to 1 pleasure dose a day. Now, if any of you have tried stopping caffeine cold turkey, it's not fun. It's really not. One of the most consistent symptoms is a dull headache that seems to last forever. So to avoid this caffeine withdrawal, what I suggest doing is slowly cut back your caffeine intake. So if you're up at about 4 doses, 4 cups of coffee per day, for a couple of days, go at 3.5. Then a couple of days, take in 3 doses. Then a couple of days, 2.5 to 1.5 down to 1. If you stretch that out over a couple of weeks, you won't notice the withdrawal nearly as much. So never stop cold turkey. It's really unpleasant. What about people who don't like the taste of coffee? Or their stomach it gets upset with coffee? Well, you can look at alternate sources of caffeine. One great source is tea. Tea is a great source. What if you don't like tea? Well, you can try the Red Bull, and I don't advocate using energy drinks as a pleasure beverage, but I do like them for the Nappuccino approach because you know exactly how much caffeine is in them and you can control the dose. Okay? So Red Bull is a good one. There's chocolate with caffeine in it. There's gum with caffeine in it. And my latest find is a dissolvable strip that sits under your tongue and dissolves and releases caffeine that way. Depending on how you take your caffeine in, it can impact how quickly it takes action as well. So if you let it dissolve in your mouth, it typically will have a much faster action. If you take it in through the stomach and it goes through the digestive process, then it takes a little longer to hit. So you can play with it and see which one works best for you. Okay, now we've talked about napping, Nappuccino. What about where you should nap? Well, I said in a sleep conducive environment. What if you are at work and you want to take a nap? Our culture doesn't yet accept freely, anyway, napping at work. So we don't all think the way Thomas Edison thought back in the early 1900s, where he recognized the link between a loss of sleep and some of the negative outcomes we've talked about. His quote is, people talk about loss of sleep as a calamity. They better call it a loss of time, vitality, and opportunities. Okay? So at work, we don't necessarily think this way. So let me give you 3 statements you can use that will hopefully make it easier to nap at work. So here's the first one. So if you are napping at work and somebody says, were you sleeping? Well, here's the first thing you can say. No, I wasn't sleeping. I was just checking my eyelids for holes. Okay? That doesn't work. You move on to the next one. Well, I'm doing the stress level elimination exercise plan that I learned at the last seminar you made me attend, the sleep plan. And then my all-time favorite is, this is an exchange for the 8 hours I spent dreaming about work last night. So I'm exchanging work last night for sleep during work, and that might or might not help. So try those. If you have any questions about this topic or my work, feel free to email me. If you are listening or watching this presentation during the conference, I'll be in the expert lounge today from 1:45 in the afternoon until 2:15. And feel free to join me in there and ask questions specific to your situation, and I'd be happy to help. Thanks for listening in. Thanks for watching. Sleep well and stay safe.